and the recording too.
Pavi, do you want to start at like around 101, following Neville's lead in the past few days?
I feel like we always need music for the start of these things.
Yeah, some of the sessions we had some music playing at the beginning. I feel like maybe I'm imagining that.
Hello, everyone. Welcome. Let's get started. My name is Pavitra Vasudevan. I'm an assistant professor here at UT Austin. I'll be serving as a moderator for this session called Conversations on Caring. This panel addresses both care work and the essential work themes of the Pop-Up Institute. And it's part of the Rappaport Center's Pop-Up Institute's Beyond the Future of Work, which goes through June 11th. So before we introduce the panelists today, some logistics. This is a Zoom meeting as opposed to a webinar so that the presenters can see the audience during the Q&A. For now, we'd like to ask you to turn your cameras off and please ensure your mics are muted. And you're welcome to turn your video back on in the Q&A if you'd like. During the conversation, please feel free to type general comments in the chat. But also, since we're not all great at multitasking, please send any questions that you have for the panelists directly to me, or you can raise your hand. If you're watching from YouTube, you can enter your questions in the YouTube chat and our student team member will pass them along to me. Also, we are live tweeting the event, so folks can join the conversation on Twitter. Sarah or Liza will be dropping in links for the Twitter handle in the chat, as well as links to the panelist bios. So this session, Conversations on Caring, is building from work on public health, care work, and racial capitalism. And the panelists will be discussing the lengthy and ongoing crisis in caring labor that's been exacerbated by the current pandemic. And also hopefully have a vibrant conversation on reimagining care work. Our panelist today, Libby McClure, is a postdoctoral research fellow at the University of North Carolina at Chapel Hill. She recently completed a year contributing to the North Carolina Department of Health and Human Services COVID-19 response team as an occupational epidemiologist. Carrie Fresher is a Southerner, an abolitionist, and an assistant professor of geography of the University of Washington. Her work focuses on low-wage food and agricultural labor in the US South, racial capitalism, carceral geographies, and the Black radical tradition. Sharmila Rudrappa teaches sociology at the University of Texas at Austin and directs the South Asia Institute. And Snehal Patel is an organizer, activist, and an internal medicine physician, assistant professor of medicine and population health at Dell Med School at the University of Texas at Austin. So I will now hand it off. I believe our first speaker is Sharmila. Are you going first?
I'm going first very briefly, and then, Libby's going to take over.
Great.
First of all, thank you everyone for attending our panel. We are just as excited to hear how this panel, flows out, just as you are. Because in our conversations yesterday, when the four of us panelists got together to think through what a panel will look like, we very quickly came to realize that we couldn't quite settle on, not just with each other, but within ourselves as well, how exactly we approach care work. In all four of our presentations today, you'll hear some of the questions and the grappling that we went through yesterday, but also what we've been doing for so much of our work. So in all four of our presentations, you'll hear us talk through the ways by which we are recasting care. We're recasting what we mean by work, and perhaps reframe care work itself. Our public conversation here today is an invitation to engage with us and with each other in this group in conceptualizing care, work, and care work. Rather than dividing the conversation up into productive and reproductive realms, or the labors involved around biological versus social reproduction, a fundamental starting point for us on this panel is that an ethic of care is an approach to personal, social, and political life that begins with a recognition that all human beings need and receive care and give care to others. So I'm hoping that is the sort of conversation our work fosters, but also the conversation here. That is what we're hoping to do. So Libby, if you wanted to start off and take it from here, then I can jump back in later.
Great. Thank you. Thanks for the invitation, and it's an honor to be here with y'all. And I just thought I would give some background on my own training and some of the framing that I'm coming to the conversation with. So I'm trained in a quantitative field of epidemiology, which is inherently oftentimes pretty reductive and likes to consider itself to be objective, but then has an underlying valuing of certain perspectives over others. And I've come to this group through Pavitra. We've been working together for a number of years in a collaborative project with a Concerned Citizens of West Baden group, a community organization in Baden, North Carolina. They're a collective of former workers in an aluminum smelting facility and some of their family members, as well as the North Carolina Environmental Justice Network. And we found through this process that most of the epidemiology research on aluminum smelting work and health really didn't reflect worker and community experiences. Specifically, we found almost nothing looking at race and gender disparities in work exposures and health, and found that most of the research was industry run, especially that coming out of the United States. And so through that, we began using the perspective of racial capitalism to analyze sort of what we were seeing and hearing from community members. And so we recently came out with a commentary with co-authors Snehal Patel, who's also on the panel, as well as Zinzi Bailey and Whitney Robinson. And we talk about how the epidemiology of COVID-19 in the US has focused on individuals' biology and behaviors, despite the centrality of occupational environments in the spread of this virus. And in our commentary, we argue that this demonstrates collusion between the field of epidemiology and racial capitalism because it obscures the structural influences on those disparities, which absolves industries of responsibility for worker safety. So the term racial capitalism was coined by Cedric Robinson, and it refers to the centrality of race in structuring social and labor hierarchies in capitalist economies. Geographer Laura Polito says this system ensures a, quote, vulnerable supply of low-wage workers through dual wage systems, racially exclusive labor unions, racialized divisions of labor, sharecropping, and related practices. Also, we drew on Dorothy Roberts' scholarship on the history of race in medicine, and she describes how focus on underlying health conditions and behavioral risk factors allows society to both ignore how disease is caused by political inequality and to justify an equal system by pointing to the inherent racial differences that disease supposedly reveals. And we looked at an empirical example using lung function inspired by our work with the Concerned Citizens of West Baden, and how race corrections in the algorithms determining qualification for workers' compensation related to lung function injury was race corrected in a way that hid the occupational based origins of race disparities in lung function. And so under the system of racial capitalism, Black workers experience more work-related health damage because they're concentrated into riskier, less protective jobs. And so the corrections understate the extent of their damaged health, disproportionately more valuable to industry than corrections that understate the workplace impacts on less exposed populations. And then for the rest of the commentary, we tell the stories of key industries that are implicated in the spread of COVID-19 in the US and argue that the risks associated with these workplaces are patterned by race, ethnicity, and immigrant status. And so I think I'll leave it there and we can get into some of the more specifics as we get into the conversation more deeply.
Thanks, Libby. Okay, so basically I'm going to read from my presentation and apologize for that. What I want to do is basically make 2 points. So let me begin. And I'm hoping, that you can get to the 2 points, but I'll conclude as well to reiterate and highlight those 2 points. Let me begin. About 13 years ago, in 2008, I began working on transnational surrogacy in India. Working with women and men who exchange wages for pregnancy and childbirth trouble the easy divisions that are made between productive wage labor, so essential to the sustenance of the economic sphere, and reproductive unwaged labor, so essential for the sustenance of family and community. Most of the 70 surrogate mothers I worked with were garment workers, recruited from sweatshops, making t-shirts, shirts, and jeans for the likes of Gap, Banana Republic, and H&M. The women that I met with spoke of the extraordinary forms of discipline they faced and the punishment meted out on the assembly line, the sweatshop, the sexual harassment by male supervisors, the rationing that they themselves imposed on themselves regarding how much water they drank, so they wouldn't need to use the bathroom as often, the extra unpaid hours they put into the assembly line so they could simply meet production quotas of t-shirts, jeans, and shirts that would be consumed in various stores around the world. And they also spoke of the long and exhausting trips on crowded buses from home to the factory and back home again to cook, clean, and care for their children. So under these conditions, then, the surrogate mother explains, surrogacy seemed easy. All they needed to do was get pregnant, live in dormitories with other women where they formed deep friendships and build the sorts of networks they knew they needed in order to glean opportunities in their precarious urban lives. While I described surrogacy as a global reproductive assembly line, traversing households in US suburbs, ova perhaps purchased from South African white women, or sperm purchased from Denmark, all assembled into new life in a third world woman's body. The surrogate mothers themselves saw something else. It wasn't as if they didn't recognize their exploitation, but it was interesting in terms of how they cast their labor, right? They perceived that their labor generated social and economic value. As Indrani, one of the surrogate mothers who I got quite close to, pointed out to me, she said to me, very matter of fact, Sharmila, she said, I make you a t-shirt, you wear it, and you don't think twice before you throw it away. But I make you a baby, I change your life, right? So at some level, Melinda Cooper and Catherine Waldby, Australian feminist scholars, describe surrogacy as a form of clinical labor, wherein the abstract temporal imperatives of accumulation are put to work at the level of the body. Though gestation is not recognized as labor per se, because pregnant women do not perform codified, quantifiable tasks, surrogate mothers offer themselves up as subjects, giving clinics and clinicians access to their productivity of their in vivo biology, the biological labor of living tissues and reproductive processes. Surrogate mothers are workers in a Marxian sense because in vivo processes of oogenesis and gestation are used to create surplus value. Right. Working with surrogate mothers, I came to realize there are no easy divisions to be drawn between productive and reproductive labor, reproductive assembly lines and care work, tending to the intimate needs of upper middle class family making, parental desires, and the burning yearnings for genetically descended children, right? My second point that I wanted to make in the presentation. My work on surrogacy has led me to engage more deeply with the literature on reproductive justice, which moves beyond simple discussions of abortion access or birth control. Reproductive justice, Loretta Ross notes, is the work toward recognizing that our reproductive and sexual health and our ability to live healthy lives depends on the realization of the social, economic, and political empowerment of ourselves, our families, and our communities. Central to reproductive justice understandings, then, are ideals of environmental degradation and food sovereignty, for example. Conceptions of care as concrete work of maintenance with ethical and affective implications, then, move away from focusing on just social worlds to pull in forms of caring for non-human beings, right? So I end my presentation with just a few questions for all of us. What does it mean to break up work into productive, reproductive, social reproduction, or market reproduction, if you will, or market production, if you will? What might it mean to expand care work to include the affective, ethical, and physical tasks involved in gardening, taking care of dogs and cats that animate our lives, or tending to the streams and creeks that crisscross our towns, cities, and backyards? And finally, might these kinds of queries that we have, thinking about human and non-human bodies and the kinds of care and a caring ethics, orient us towards a politics beyond work? So those were my comments for today. I guess it's Snehal and Carrie.
Yeah, I can go. I'm really honored to be a part of this conversation as well. And so I'll start thinking about this current moment, right? More than a year into the pandemic that in many ways has made it more difficult for already undervalued care work and workers, both paid and unpaid. And in other ways, and trying to think through this, has maybe created or is allowing for the emergence of opportunities for reimagining care work at a community and collective level. So I'm a healthcare worker, an internist, a hospitalist. I work in the hospital, and for the better part of the past 15 months, I've been helping care for patients that are admitted to the hospital with severe COVID-19. And some weeks have been absolutely horrendous, with several patients dying within a week without family present. Really, in the presence of very isolated healthcare workers, whether nurses or respiratory therapists, medical assistants, custodial staff, physicians. Inside the hospital, in some ways, there's been an increase in collective spirit amongst frontline healthcare workers, I would argue. If only in the sense that the sort of work over this past year has there's been this collective trauma, certainly in general, but acutely felt within the hospital. However, traditional hierarchical divisions, differential occupational risk and hazard, pay, differential protections, all really continue to prevent true solidarity and possibilities of organizing across healthcare workers. So, something that I'm thinking through is, in the space of healthcare work, where are the possibilities of building collective healthcare work? Right? Where are those possibilities? I'm also an organizer and activist, and working in Austin with Communities of Color United for Racial Justice. So, one of the things that I'm thinking through is, how is community organizing, advocacy, and activism? How can that be framed as collective or community care work? So, healthcare workers across the U.S., specifically lower wage healthcare workers who are disproportionately Black and Brown, disproportionately women, have been, understaffed, underpaid, underprotected, long before COVID. And, as COVID's ravaged through the United States and the world, in healthcare, there's really been little pressure from federal or state workplace regulators to improve safety at the worker level. And this is particularly true for lower wage, non-hospital based care workers, including home health care workers, nursing home workers, perpetuating racial disparities of workplace transmission and of community spread in areas where frontline essential workers live. We've heard over the course of this past year countless stories of nurses, aides, care workers without access to adequate personal protective equipment, paid sick leave, job security, other basic worker protections. We've also seen that in places where healthcare workers organized, and in particular where healthcare workers are organized in their unions to fight for safe conditions and protections on their jobs, they've had better outcomes. For example, in New York, long-term care facilities where workers were organized saw significantly lower COVID mortality rates, about 30% lower than in non-union facilities. So, for some frontline healthcare workers, I think working conditions over this past year have changed some of the conversation around organizing. We're seeing a slight uptick in new membership with National Nurses United and with the National Union of Healthcare Workers. So, where I see some possibility for organizing amongst healthcare workers in the midst of this pandemic, in the midst of the ongoing moment of racial reckoning, in the midst of health inequities being sort of made crystal clear, healthcare workers sort of re-asking this question: who do we serve, and who do we protect? Who do we work for, and why? Do we serve at the behest of our employers, mostly private healthcare companies functioning within a for-profit system, or is there an opportunity? Can we reimagine sort of new possibilities of care and public safety that emerge from a greater public health lens? Can we as healthcare workers build collective action to serve and protect the communities that we care for by working towards building new systems of community care? You know, we've seen the effects of long-term underinvestment, undervaluing of public health and public health workers, and you know, despite witnessing this, you know, during this current moment, much of public health and medical messaging remains in a very narrow lane of personal health and responsibility, and in preventing, you know, and treating disease and illness, right? Like Libby, as you talked about. So, you know, one question I have is, how do we as healthcare workers support a more ambitious agenda of public health, right? That's rooted in frameworks of social medicine, that's rooted in frameworks of structural analysis and structural determinants of health. A place that I see some hope around this, and this comes from a long history in the global South and a more recent history in the United States, is in the building of cadres of community health workers. Right? Frontline public health workers who are from and have close relationships with the communities that they serve in order to support individual and community level healthcare. And I think a core component of the work of community health workers is as community organizers, right? As capacity builders and advocates who promote community action and collective empowerment. And you know, in this way, there may be an opportunity for other health workers, other healthcare workers across the spectrum of healthcare to align with community health workers to build new systems of community care, as well as possibly to build new alliances in the organization of healthcare workers. Right? Going back to sort of thinking about you know, expanding our notions of what is care and what is work, can we think of community organizing and advocacy as care work, right? In particular, so reflecting on this past year, the work of activists and organizers, you know, part of a long tradition, a long history of organizing for racial justice, social, economic, environmental justice, abolition. How do we think of this work as collective care work? That is, the work of organizers and activists as work that we do in the care of and to care for our communities. Here in Austin and you know, really across the country, in many places, organizers and activists and community members, especially Black and brown women, are demanding that cities reallocate their budgets to support, you know, public safety and public health goals, right? To reallocate city public police funds to public health, to housing, to childcare, and broader community care and safety efforts. And much of this work is fueled by community members and advocates performing unpaid work to improve community care. In addition to community care that organizers, advocates, and activists are pushing forward through demanding budgetary and policy change, they're asking the questions, how do we mobilize our people and our communities to care for each other in the face of this perpetual myth of individual independence, right? As Mia Mingus put it. So we're seeing growing mutual aid networks in, you know, which folks are directly supporting each other with material survival needs, food, water, shelter, childcare, medical care, at a time when formal state-based systems continue to fail to sufficiently provide these resources to those that are made most vulnerable. And these mutual aid networks also support the building of social movements and organizing work, right? Creating collective childcare spaces allows for collective work of organizers and activists to take place. Providing resource support through mutual aid brings individuals and communities together to build power to shift policy priorities. So in expanding this discussion on, you know, what is care and what is work, I'm thinking about how community organizing, how community health work, and mutual aid are forms of collective care work. And I'll pause there and pass over to Carrie.
Hi, yeah, thanks y'all. Thanks for inviting me to be a part of this really great panel. And I appreciate us we met yesterday, as Sharmila mentioned, to talk about like how we were thinking about these questions of care and care work. And it's really excited to actually practice some of the things that we're talking about through those conversations, right? So thanks for being here today. I'll start with just thinking about this current moment, as COVID-19, I think represents for many of us, the culmination of multiple ongoing crises of racial capitalism. And when we look for it, when we look for it, racism is visible in historical and ongoing ways, enabling capitalist land distribution, dispossession, exploitation, and plantation agriculture. And this is how I try to conceptualize racial capitalism in my own work. I use this framework to understand the how, why, and where of industrial agriculture and food work. So last spring, people really began thinking very critically and carefully about meat, where we get it, who produces it, and to what effects. And this sudden attention sort of happened for a number of reasons, right? We were bombarded with images of chickens and pigs that were ready to be euthanized by the millions across the country and the world. Fast food chains began running out of hamburgers, and grocery store prices of pork loins were skyrocketing. And the National Meat Institute, NAMI, and yes, we have a National Meat Institute, mobilized against the calls and warnings of public health officials, of worker advocacy groups, and a larger concerned public to keep meat processing and poultry processing plants running. They even worked with the previous administration to pass the Defense Production Act, right, to enforce those plants to keep running. And so this is one way that I think about the current crisis and how many of us are thinking about meat and meat work and the people who produce meat in our country. But another way of understanding this is to think about what I call like more quiet, intimate ways. Through the obituaries of some of the first workers in poultry processing to pass because of the side effects or complications from COVID-19. And three of those workers, Miss Ellis Willis, who is 56, Miss Mary Holt, who's 56, and Miss Annie Grant, who's 55, all worked in the Tyson Food Plant in Camilla, Georgia. And these were all Black women, union members, mothers, daughters, aunties, all working collectively in this plant for 77 years. So I think about these two things together, because not just to recall a story of despair, right, trauma, but to think about these people as more than just exploited workers under racial capitalism, and think about their fuller lives. And in many ways, as Sharmila sort of pushed us in the beginning, to think beyond the concept of labor, a category of labor. So I hold these stories within the same frame to think about the long history and labor of women, and mostly Black women, in feeding our love or addiction, depending how we look at it, to processed chicken, to cheap processed chicken. And I believe that this examination helps us understand racial capitalism through the lens of food, but also ways of being and living otherwise that persist in spite of this system's dominance. And in this moment, I also wonder about the quiet separation and dominant discourse of COVID-19 and the uprisings in defense of Black lives, and appreciate all the people, many on this panel and in this larger Pop-Up Institute, who are thinking about these things as historically and geographically relational. Another piece of my work is connecting prisons to poultry industry, as these are two sites of what geographers think of as organized abandonment. So purposely abandoned peoples and places as sites of racial capitalist accumulation. So in this work, I wanted to understand hotspots, right, as they popped up relationally in both animal processing plants and their broader communities, right, because the COVID-19 was not constrained to those places, but also prisons across the country. Right? And this comes through research, field work with workers and their families and broader communities in Northeast Georgia, but also to movements around prison abolition. And And so across prisons and poultry plants, I think racial capitalism structures whose lives are valuable and whose lives are not, but also what places matter and what places do not through the organization of space and time. And a structural way of understanding life and death that helps us understand not only life and death, but connectivity across movements. So what are the openings, as Snehal is like pushing us to think about, across sort of unexpected sites? What are the relationalities that we might see emerging in moments of crisis, right? This is the exciting work to me. And I think, responding to this question on care, I think of this in two ways. First, in food work. So poultry processing work is fundamentally food work, right? And we all need to eat to live. This is kind of what brought me to this work in the first place. And I'll just start by quoting Kiese Lehman, who often writes about his grandmother who worked in a poultry plant in Mississippi for decades, right? And he says, there's layers to this, and he's quoting her. Grandmama often said when describing her job to folks, she went into that plant every day knowing it was a laboratory for racial and gendered terror. And that's the end of that quote, right? And so I think about this quote, it's sat with me for so long, and it's so straightforward and simple, but I think it helps us peel back the layers, right? To understand the conditions that shape this very essential, right, food work for our country. So I think this helps us also think about Sharmila's point to get beyond just narrow conceptions of labor and workers as paid work, right? And those people are the ones who matter in labor organizing, and our sudden shift and focus on essential workers, right? And it's not to abandon labor specific organizing, and by that I mean organizing around and for better conditions of paid work. But I do want to think and do with what Tyree Scott and Cindy Domingo, who are two labor organizers up here in the Pacific Northwest, what they call working class geniuses, right? Past and present. So what does it mean if we take Jimmy Boggs's words, thinking and doing, and Jimmy Boggs was an auto worker in Detroit, Michigan, originally from Marion Junction, Alabama. When he studied the decimation of the auto industry there in Detroit, what it did to all workers and communities, but specifically or especially to Black workers in their communities. And he came to this very simple conclusion by saying, the job ain't the answer. A job ain't the answer, right? So what happens when we see the 50 Black workers who walked off the line in Kathleen, Georgia, when they said enough is enough at the poultry plant back in April 2020, not only as workers, but as people with whole lives, families, experiences, ideas, feelings that are shaped and constrained by so much more than their work at the chicken plant. What happens when we think holistically about the conditions that produce shitty jobs in the first place for people and places produced through and abandoned by capital? Instead of more shitty jobs to feed America, might labor movements and unions create the conditions for their own demise? To follow the lead of Black Southerners in Jackson and beyond, calling for cooperative and community-controlled work and broader social systems. Might we think also about the long struggle for abolition? That's the one rooted in the great experiment, and that's Du Bois's words, right, of Black Reconstruction, and persisting in radical abolitionist organizing that simultaneously tears down while building alternatives in its place. And I have some more things to say about organizing and responding to some of Snehal's really, really provocative questions, but I'll pause there and let us have more of a discussion if y'all want.
Thank you all so much. Those are incredible presentations. And to be honest, I'm not sure what role I can play as a moderator other than kind of opening up the space, but I thought I could kind of reiterate some of those questions so we could all hear them and just kind of frame them a little bit. So in Libby's work, in Libby's presentation, we heard about and we saw the ways that work understood, right, as production, work sites, and care, that work with social reproduction are actually quite interwoven, both in the case of the aluminum smelting plant work that Libby and I have done, as well as in the ways that that connection, that division has been reiterated in the kind of quote unquote solutions or understandings of the pandemic, and the failure to address work as known as it is, that occupational exposure has been, has been really the site of transmission around COVID-19, and then the turn again to individual biology and behaviors and treatment. In Sharmila's presentation, she closed by asking, what does it mean to break work, to not break work up into these artificial spheres of production, social reproduction, biological reproduction, and what would it mean to take seriously the affective, ethical, and physical tasks that are involved in maintaining homes, families, and our ecological, broadly speaking, relations, not only with humans. What would it mean to take that work seriously and to consider that work as reproductive justice, that it's not, reproductive justice isn't either only about the individual body or the capacity to have or access care for children, but really about that work of maintaining life that happens, and all humans, as you said, Sharmila, really need and also provide care, which I really loved that reframing, that is actually, it's universal in a certain sense, that it's actually, even though labor tends to structurally be divided in racial and gendered terms, that the fundamental need and ability to provide care is actually a universal, and that might make some shift possible for us to understand that universality of care. Snehal had closed with thinking about this kind of moment of reckoning where so many of the structural divisions are being reiterated, but also these identifying these moments of possibilities, including, for example, that organized healthcare workers, spaces of organization actually led to improved outcomes, the kind of growth of solidarity spirit among hospital workers, and this rising tide around community health work, which is both, from my understanding and from our conversations, seeking to be co-opted back into maintaining the healthcare system as it is, even as it creates the possibility for seeing care otherwise. And Snehal had talked about, building coalitions with community organizers, and I love that reframing, that, thinking about that work of organizing and building collective power and space as care work, that is work that both requires care and makes possible other formations of care, and that it is care work in itself. And we're seeing that, I think that has been, for so many of us who care about these questions, that has been, it's been so inspiring actually to see the rise of mutual aid networks, to see the amazing and widespread collective organizing that's happened, particularly in relation to abolition, and really at quite large scales. If you think about, communities that are disenfranchised and people doing unpaid work all this time during the pandemic to transform and push back on city policy, for example. So that, lots to think about there, I think, in terms of possibilities. And Carrie, I really loved how you talked about the openings we can see across unexpected sites, and these kinds of relationalities emerging in moments of crises. And that, that image you left us with of the workers walking off the plant and how their demands were not only about work, right? Jimmy Boggs, the job ain't the answer. And I saw that also, as you know, I've seen that in my work as well with aluminum workers, this kind of exchange that is made for wages, that often workers both know the exchange they made, know what they're walking into, and even knowing that that's not the answer, that their lives, are so much more than that, and seeing their organizing as a kind of imagination of something else that is possible, that that they're calling on all of us really to do that work of reimagining. So what happens, Carrie asked, when we think holistically about the conditions producing shitty jobs in the first place, can labor unions create the conditions for their own demise? I really love that question. That even the quote unquote solutions, right, of organizing that we turn to often as answers, thinking of workers only as workers, that even those quote unquote solutions, right, structural solutions require reimagination in order to think past these divisions, that workers' lives are not only at the plant, which, has been a consideration of feminists for such a long time, and that taking the social reproduction work, taking that work of maintaining life seriously means thinking of that work of creating healthy communities, environments, is the work of abolition. That is the work that we all need to do. And I wanted to, just to close out my comments, draw attention to this review paper that came out recently, written by also faculty at UT, Hi'ile Hobart, along with Tamara Neese. I'll drop the citation in the chat in a second. But they write about radical care, and it's a special issue, and their intro to it is a really wonderful summary in some ways of these questions around radical care and survival strategies for uncertain times, is how they frame it. And the rest of the issue really gets into, each paper talks, to some extent about these questions around the affective, ethical considerations, but also about actual strategies, right, that people are coming up with to enact, to make possible radical care. And we might think of radical care from that paper as mobilizations of care that allow us to envision what Elizabeth Pavanelli describes as an otherwise. And I really love that in building these other forms of care, we are imagining enacting an otherwise, making other futures possible. And in particular, they identify, these kind of, when we say care in the general public, we often think of self-care, which is so popular, and also in this time, right, has become really a mantra for a lot of people, feminist self-care. But even feminist self-care, when we think about in these contexts about care workers, right, what does it mean to care for ourselves, for people who are doing that work? What does it mean for abolition organizers to have to also figure out ways for themselves, their families, and their communities to survive in these uncertain times when they've been abandoned by the state? And so thinking about both self-care, but also the work of activist care, particularly that has been driven in this country often by Black and Brown women, who are continuing to provide the forms of care that the state doesn't provide, right? And again, with COVID, we've seen that over and over. So I'll just drop that in the chat, and I'll open it up to you all to have a conversation across your presentations. I also see some hands, but let me give the panelists a few minutes, maybe 5-10 minutes, and then we can, unless you want to go to Q&A right away, but I'd love to see what you had to say to each other.
I'm wondering if we can actually just open it for Q&A and then use those Q&As to weave our conversations together, if that's okay.
Sure, of course, let's do that. So I see Philip Bear's hand, and there's a question in the chat. So why don't I go to the chat question first from Ann Lewis. I question the division, and says, between community organizing and labor organizing. When mine workers organized, they not only changed wages and working conditions, but also busted the coal company towns, policing, and created a progressive community healthcare system. More recently, I documented a successful poultry plant organizing effort, pro-union 400 plus to 18 against undocumented and Latina, that would not have been possible without intensive community organizing. So I think that's been kind of just thrown out generally. So if anyone would like to pick that up, the division between community organizing and labor organizing, and that workers often have also organized for their communities, right? Community conditions.
I can, yeah, and I thank you for that comment. So yeah, my goal definitely not to draw a line between labor and community, and I agree with you. I've seen it historically with radical labor organizing being very rooted in the community. You could think of it in terms of community unionism, or like you just community organizing, right, with movements across the country. I think about the South and the Black communists, Alabama. This is Robin Kelly's amazing work, right? What was possible because of those links of labor and community. And so I agree with you 100%. I also think, I don't want to draw lines between, but I think there are also sometimes within labor organizing a very narrowed and focused attention to the paid side of production, right? And in the South, I think there are particular challenges, which you've seen in Tennessee with your work, right? Because of the real lack of support and funding, but for a lot of the unions to actually do good work, community organized and rooted in the community kind of organizing work across parts of the South. I saw it in the poultry plants that I was working in. One was organized by UFCW and successfully right at the 2013, and they were successful on the backs of all this anti-immigration legislation. And they were, while there were real efforts to build across undocumented workers and quote unquote native born Black workers mostly, those efforts were pretty, they were pretty much decimated through anti-immigrant legislations across the state, and then the plants themselves sort of following up and accepting that legislation, right? And so I'm thinking, not trying to disparage the kinds of organizing that was happening there. I think it was really important and exciting, but also thinking about the immense structures that are making the beautiful community organizing that you're talking about nearly impossible, right? So I would love to hear more about like your film, and I think that's something that we could discuss too, the kinds of community organizing that you were seeing. And also here in upstate New York, I think I was on a panel recently with some organizers out in Eastern Washington, and they're talking about, their lack of entry into the support through the NLRB and through those sort of formal channels actually opened the doors for different kinds of labor organizing outside of the big unions that they find really, really powerful. So they're able to organize families, right? And they wanted to frame their organizing around families and not around workers as this only the people who are working in the processing plants, but also thinking about broader community needs like you're talking about. But yeah, thanks for that comment.
Anne, did you want to respond or speak?
Sure, but I think there are all kinds of other components of this conversation that are really important. I just want to say that I think there's a real stereotype of what labor organizing is. First of all, we close our eyes and we see a white male factory worker every time we think of a labor organizing. And in fact, it's predominantly women and very heavily women of color. I think that we have a very strange understanding of this. And I love the reference to Hammer and Hoe and this notion that we're all in this together, and thinking of workers as full people with agency. I think also that nearly every single victorious effort at labor organizing has included an uprising of a people, whether that's regional or based on race or ethnicity. It's part and parcel of the ability to win over a corporate structure. So I think it's terribly important to include those possibilities of workplace change. And the issues tend to be around health. That's the other thing that I think we don't realize. Occupational health and the mine workers and the rank and file uprising around Black lung disease. In the chicken plant, one of the major issues was water splashing into eyes and causing eye infections. That's the kind of stuff that workers organize about. as much as wages and benefits and that kind of stuff. So I think for care work, these kinds of uprisings among workers, which is probably a better way to look at it, are incredibly important still. Yeah.
And Nina Ebner in the chat also wanted to point out that it's interesting to think about how demands by workers, even at the so-called point of production, are often reproductive, whether explicit or implicit. With the example of maquiladores in Ciudad Juarez during the pandemic, where there were wildcat labor stoppages where people demanded to be sent home with full wages and made demands like "we want to live." Thank you for that. Let me turn to, I think I saw, was it Philip? Can I ask you to?
Yeah, thank you. Really, really rich and powerful presentations and discussions. I have to apologize because I have to hop off exactly at 2, so I might be able to just ask my question and hear a few words. And it's sort of an idiosyncratic question. I was just wondering if anyone had any thoughts about. Yesterday I heard 2 juxtaposed radio interviews, and I've been kind of disturbed by them ever since. And one, the issue was a nurse, I think it's a hospital chain in Connecticut with 26,000 employees, but I forget the name of the chain, who has organized some of her co-workers, but not only nurses, other hospital workers, in a lawsuit, excuse me, against the hospital's mandate that all hospital care workers have to get vaccinated in order to keep their jobs. And so they interviewed her, and then they interviewed the CEO. And instinctively, I was, my sympathies were not with the CEO. He was very kind of like smarmy and condescending and all the things that CEOs often are. On the other hand, the person who had worked, the nurse who had organized this class action suit, and I guess she's working with an attorney, was just, saying stuff that, from everything I know, is complete misinformation about the vaccines. And I did think that the CEO was using the language of care, and it did feel like he made a good point that, in order to care for our patients, we need our workers to care for themselves, and we need them to do it by getting these vaccines. And then he added, and anyone who doesn't is basically given 2 weeks notice and fired. And so I just wondered if anyone had any thoughts about that kind of situation. I mean, I think the issue of vaccines and mask wearing and all that has given a different spin to some of these questions about corporate or government imposition, specifically of different forms of biopower over workers and others. And I say that mostly because I kind of tend towards thinking people should have been forced to wear masks, should have been forced to. I mean, I confess that. So I don't know if anyone has any thoughts about that.
I'm wondering if, this can also be just a conversation of just not amongst the panelists, but we open it up to everyone, right? And have it more of a conversation.
I just think it's completely an example of the horror of individualization of an epidemic. It represents what's wrong with racialized capitalism in a profound way, that people think of themselves as individuals rather than thinking of themselves as part of the institution that they serve and that they need to protect and part of and parcel. I mean, it's alienation at its most basic. That's my sense of this.
Yeah, I agree with that, and also, see the collective will of whatever group of care workers to determine sort of what goes into their body, right? And so I agree. I think the way that policies during this pandemic certainly, but public health related policies transpire in a very individualistic, very sort of personal health approach to how we're going to decrease risk and improve public health is the problem, right? So mandating individual masking is necessary and insufficient in many ways, right? It's not. It's a sort of a very narrow way of thinking about public health. And at the same time, I think collectives of workers, whether that's in the healthcare space or in other spaces, I think part of the process of building and maintaining autonomy within the space of workers is to be able to have say in that. And so I mean I think I'm not advocating one way or other here, but I think there's a tension certainly, and that tension exists between public health and whatever other collectives might exist, right? And so that there has to be a process of mediation there too.
I thought I would also offer a little bit of perspective from coming off of a year of naively going to work for the state government, thinking it would be here to protect the people. And I've been thinking a lot in this past year about what my former mentor, Steve Wing, who unfortunately passed away a few years ago, would be saying in this situation. And I think, I spent a lot of time trying to work on the sort of worker health team who never once made an effort to talk to workers themselves, but only were talking to the employers. And as soon as the vaccine became available, that became the only focus. And, everyone was sort of shocked when workers at the poultry processing and the meat processing facilities were not interested in receiving the vaccine from their employer after, not being given paid sick leave, not being, being disincentivized from getting tested, any protections in place beforehand. So. Yeah, I think that's all I have on there, Carrie.
Yeah, I think there's a similar tension here in Washington State with inside the prisons. I mean, DOC was trying to vaccinate people, and I'm part of Free Them All, which is an abolitionist group here, grassroots, and we were contacted by the King County Department of Health to try to understand the situation from all the folks and loved ones that we have inside, and their response and trepidation and fear of taking the vaccine, right? And I agree with Philip. On the one hand, we think, I took the vaccines and I'm excited to have the vaccines and to be with family and loved ones inside, but I also understand the distrust, extreme distrust of the federal government, of the Department of Corrections, of the people administering the vaccines, and the lack of communication or transparency on that process, right, for folks inside. And so our recommendation was to work with some of the, there are several Black-led public health initiatives happening here in the region and there are public community vaccination clinics that are happening that are rooted within the community, right? And that's a very different approach to this conversation than the approach that DOC had. It's a great question, though.
Thank you, Philip. I see Sonia. Sonia's hand up.
Yeah, hi. I had a question about the use of the term racial capitalism, and I was wondering if you could speak a little bit to the use of that term in a more global context. And I think that the way in which COVID-19 has been addressed across the world has been so distinct that I just worry about the use of terms that are coined in one society, one country, and the ways in which we're looking at other countries and how these various countries are handling something like a global pandemic. I was wondering, I know that you focused very much on the US, and I was just wondering if you've had a chance to consider this within the global context. I also wanted to thank all of you for these really informative and engaging conversations. And also I'm curious in terms of Sharmila's work and the transnational perspective that you brought. The idea, I was really struck by the comment that the lady with whom you worked essentially spoke about a t-shirt versus making a child as something that one remembers, and how that's contextualized within also a society in which, or a country in which there are children in need who could be adopted, but for political reasons cannot be adopted internationally by non-Indian or individuals that are not connected to India. How that justification as an individual is ingrained in us to say, well, it's not a t-shirt, it is this reproduction, and therefore there will be the remembering and the awareness that's justified by the fact that they're also working within the constraints of a society in which one has to question reproduction in general. So I was just curious about both topics. Thank you.
Thank you, Sonia, for those questions. And at some level, I see those as related. The question of racial capitalism and the ways by which, especially third world, calling them third world, these surrogate mothers who are engaging in surrogacy, right, where we valorize their reproduction for market purposes. But for the longest history, India has had some of the most virulent forms of population control. So the very women that I worked with who were surrogate mothers had all been sterilized. They'd all had their tubes tied, right? So they're at some level, caught up in these networks of the ways by which populations are being managed and the ways by which the bodies are being manipulated. And I'd really like to think through this conversation through the lens of racial capitalism. If you were to think about it in a global sense, when you think about the ways by which even India is understood to have a population problem, where that emerges from, right? These long histories of imperialism, famine in India, mass death. Some of the work that I've been doing is even thinking about how it is that India is starting to be seen as having a population problem, right? The famines of the early 20th century, the late 1900s, millions of people are dying on the street, right? And that is under colonialism, what Mike Davis calls, the late Victorian Holocausts, right, of the 1800s, late 1800s. That doesn't get necessarily seen as a problem of distribution, but it starts getting seen as a problem of Indian overreproduction of people, right? And so it's not the ways by which food gets distributed and what's being grown, and where that food is done, as Mike Davis beautifully says, right? While Indians are starving, Londoners are eating Indian bread, right? So and I think there's ways by which we can think about this kind of racialized capitalism is never at some level an abstract form of accumulation, right? Or surplus extraction. Questions of race and gender are implicitly and intricately tied into ways by which capital is organized and produces wealth, I would imagine. So for me, I'm wondering whether at some level that Sonia addresses some of these issues and thinking about, assisting production, reproduction, desisting reproduction, and it's all happening in the same body. And who is this woman's body going to be used for is the question that comes up. And it's not surprising at some level that women themselves look at the kinds of evisceration of life that is happening in these garment factories, where all of us are wearing T-shirts from Gap and such, right? Right, the fast fashion and the disposability, and women see their lives as being disposed within that, right? And to say that, to think about how there's a kind of valorization of reproductive labor and the ways by which they connect to that and see that as value, right? It's not at some level, I guess, surprising at all. I mean, I could say so much about vaccine diplomacy and what's going on, but I think Carrie's had her hand up, and I'm going to stop there.
Can I also, Carrie, are you addressing this question or are you shifting gears?
No, I just don't know technology. Sorry.
Okay.
I wanted to jump into around that question. I think it's an important one about the term racial capitalism. I'm actually working on a special issue right now that's thinking about difference in India, broadly speaking, right across caste, religion, indigeneity, tribes, and why thinking about them in terms of racialization is important. And one point, to think about already, right? We think of race as emerging generally in the transatlantic kind of context, right? And the Americas. But if you think about kind of global capitalism, it is like truly global in scope. And so there's a way in which different regions are interpolated into that. So that's one point I wanted to make, right? That when we think about who are care workers in the US, which is kind of the point we were making in our article on COVID-19, workforces are racialized, including, which immigrant populations serve in hospices, for example, or work in meat industries. Even if you think about, the industries in the US that have been most vulnerable, like here in Austin, construction, agricultural labor, these were historically, right, industries that were Black workers. And then particularly in relation or in response to organizing, right, were shifted to immigrant workforces. So there's something already, right, about racial capitalism that is about flows, right, about flows of workers across regions and across, including those contexts that we don't think of as in terms of race in the same way. And the other point I wanted to make is, if you think about how COVID has played out, for example, in India, there's a very racial dimension to it about who has been similar to here. And again, I'm saying that in India, it's not thought of in terms of race and isn't spoken about that way. But if you look at who has been made increasingly vulnerable, precarious, for example, migrant workers within India, I'm talking about workforces, right, migrating even within the context of the state, that it has predominantly been, for example, Muslim folks, poor Muslim communities that have been more vulnerable because of their lack of structural protection, outright violence during COVID times, as well as migrant workers, for example, from the Northeast who have migrated to urban centers and were, basically told when the pandemic initially broke out there that they had to return home. I mean, you're talking about return home by foot, on trains, on, absolutely no protection. I'm not even talking about workplace protection, but, fundamentally precarious. So there is a kind of racial dimension in that sense.
Can I also add?
Yeah, please jump in.
It's
Yes,
also Dalits
and Dalits.
as well. So we can actually also include Dalits into the question. And at some level, what has also been happening is, this is something that I've been working with a graduate student of mine, is, in India, we've been seeing images of cremation grounds and the lack of space, forget hospital beds, right? There's been a huge lack of cremation grounds for Hindus specifically to cremate their loved ones. But along with that, what we're also not seeing, but is hugely prevalent, is burial grounds for Muslims. Burial grounds are already such a fraught political question in urban India, as there's all these land pressures, and the Hindu right-wing government does not sanction land to various Muslim communities, religious organizations with burial. So burial grounds for Muslims have become incredibly fraught and politicized, that even in death, right? You see the ways by which, if you want to call it racial capitalism, playing out. And the other thing that we've been seeing is a foster care and orphanage and orphan crisis. Because unlike the famine, when you saw the youngest die, COVID has left parents and grandparents dead, and there's a huge foster care, but also orphanage crisis right now in India. Right. Sorry, Neville had his hand.
No, please. Thank you, Sharmila. I had Nicole's hand up, so I'm going to call Nicole and then Neville.
You could call Neville first, because mine kind of goes in a different direction. So I'm suspecting that his is part of this vein.
Okay, Neville, is it?
It is
Okay.
A response to the racial capitalism term question. I mean, and I think I want to make 2 points. One is, I think, kind of theoretical terms move. So just because racial capitalism, and actually where and when it's invented, is a complicated, at least binational story. But I'm just like, I think we can use it where it applies. I mean, I wouldn't say actually we can only say the social contract when we're talking about France, because that's where Rousseau coined the term. So I think there's a terminological point about the cosmopolitanism of theory and the usefulness that it can't actually be contained in its place of imagined national origin. And then if we think about racial capitalism, and I'm not talking about what it refers to, I'm just talking about the genealogy of the term. It's actually used in South Africa to explain the South African situation round about the same time, maybe a little bit before that Cedric Robinson coins it. And so I think it's not just an African-American term, and it's certainly not just an American term. And also, if we think about it, African America as a diasporic site, and actually the fact that there are so many Black people in the United States as a result of slavery, these histories that racial capitalism names are global, and in a way have always been global. And so I kind of think that we need the cosmopolitanism of that term. And it actually, and I've been loving these Indian examples because they show how racial capitalism works to differentiate amongst workers, even when the term race is buried under class or operates in the guise of other forms of embodied differentiation. So I just want to make a strong case for the utility of the term of racial capitalism for describing situations well outside any national context.
Thank you, Neville. And I've dropped a few more citations, if they're helpful for folks, of recent work that's been coming out, collections mostly, and a solo article. Nicole.
Yeah, thank you for that, Neville. And thank you for this amazing panel. I really appreciated hearing all of you, and you had me going in circles in my mind on all these different ideas. And thank you, Pavi, too, for putting all that stuff in the chat. I love all the citations. My question is really about movement building and what's possible in this moment, and where care fits into that. and care work in the very diverse ways that you all have described it, where it fits. One of the people I had an argument with someone in my union not too long ago, and she insisted that the only thing that that we can do in the US, and I'm sorry to bring it to the US, but is contain the right. And so I guess I wanted to hear you all respond to that provocation from your various standpoints, and to think about care work as part of movement building, and to, yeah, I don't want to take the conversation too far afield of where you started, but I think it's very relevant given how all of you positioned yourself in the conversation.
Okay, can I quickly jump in? Thank you, Nicole, for that conversation. I mean, that question that pulls us all together in particular ways. And this is something we were grappling with yesterday. I keep sort of wondering about this, and I know this is sort of a strange thing to say in a panel or a pop-up on the future of work, but I had to bring it up, right? There's so much value, what shall I say, social, cultural, what shall I say, ideological value that is put on the idea of a worker, someone who's productive, someone who's not mooching off the system, right? Whereas we know that, having at some level people unemployed is very central to the workings of modern societies, of modern economies. What might it actually look like if you decentered work and workers and thought about those who are not working, right? The so-called unproductive, right? What might it actually look like to pull away a focus from actually organizing on the issue of work? It's just a provocation that happened. It's a really strange thing to be saying in terms of the future of work, is to say, forget work and the worker, right? Because we valorize it so much. We think about these as really the deserving people, right? What might that look like? I don't know. It's a question and a provocation that I have for all of us, I guess, especially in a pop-up that looks at the future of work. But thank you, Nicole, for that question. It raised that for me.
Do any of the other panelists have thought about movement work, either about Nicole's very provocatory provocation about containing the right?
Can I ask you, Nicole, to share some of your thoughts about your question?
I said, come on, I want to hear from you all. The way I answered her at the time, I definitely think we have to do way more than that, and we are, right? I think that the point is to build across, beyond the United States and across global lines. And if we don't do that, we're doomed from the beginning, because these forces are global. And so I definitely think we have to do more than that. I think we're doing more than that. And I think we have to really look beyond national territories and really mobilize beyond the normal ways that people talk about it. And I think there's lots of ways to connect. One of them is one of the ones that, you know what, why don't you all give me your ideas? Thank you.
No, Nicole, you just said one of the ways. Tell us, Nicole, what do we need to do? I like it. I think we're all waiting patiently for you to speak, Nicole, actually. But I will call in a panelist if that's not going to happen.
I think I like that you asked this question, Nicole. Thank you. I think about this in up here in Washington and down with folks in Mississippi and around abolitionist organizing, right? And there's so much time we could spend focused on the horrors of the Department of Corrections and how they treat people inside and families and everyone else. And we do spend time doing that work, right? But it's also so much about building real deep and long-lasting relationships with one another, imagining what the future of a world without prisons will look like. How do we build alternatives to policing that lead and produce prisons, right, in our communities. And that is slow work and hard work, but really important and beautiful work that I think is the only way possible to sustain us as full human beings, right? I think spending all of our time focusing on what we don't want in this world is exhausting. It's not to lose sight of that, right? But I think we have to have so much more, and so many other people have said this so much more beautifully. So I'll leave it there.
I posted a link in here for people who are interested in, this is a volume coming out of lessons from transformative justice. And I'm bringing that up. I was thinking about, Sharmila, what you were talking about with the kind of people who, you know, are seen as unproductive. But this is especially work that's coming out of, I think, disability rights, not even rights, disability justice movement and transformative justice movements, about how do we think about accountability and building that aren't only about survival, but actually imagining and building, right, the kind of systems we want, beginning with those who are seen as unproductive in some ways, or as, you know, not fully capable. So that might be a kind of interesting take, I think, and that's coming out more, I think, also in abolition work is building around disability justice. Any other thoughts from the panelists on this question? And then Neville has his hand up. Sharmila, go ahead, please.
I was just pointing that Neville had his hand out. Sorry, that's all.
And this isn't a new thought, but sort of echoing, you know, Carrie and Nicole, what both of y'all said, that you know, from my experience and what I'm seeing within, you know, movements and organizing work, you know, in the U.S., you know, going back to Nicole, what you were bringing up, it is really about that long-term visioning. And I know that, you know, in the panel a couple of days ago, Nicole, that you were facilitating or moderating, this came up about, you know, near-term work and long-term transformative visionary work, and that is not about, you know, just pushing back against the right. It's about building the new world that we want, and so, you know, one of that to me is work, right? That is the work that we're engaged in. It's not necessarily, you know, as Sharmila put forward, right, like within the model of neoliberal productive work that may necessarily be paid for work, but it is the work of building a new world. And I think that, you know, yeah.
Neville, thank you for your patience.
No. I mean, I think, Nicole, your friend or your interlocutor sort of poses the question to me that is at the heart of the difficulty of left politics in this country. And I can make an analogy sort of from queer politics. So for somebody like Lisa Dugan, the liberals are the enemy. That actually assimilation, co-option, normalization is the problem. And that actually it's what's standing in the way of like producing let me just use a shorthand, a sexually freer world. And then for somebody like Gail Rubin, who I also respect, it's the right that's the problem. And I kind of think if we're thinking about this on the terrain of work, I mean, the slide from liberal to neoliberal is a fairly short slide. And it's actually, if you like, the technocratic elites are as responsible for outsourcing, for a whole range of problems that we face. And so I kind of think this is where one has to be strategic. So like when Trump was in power, I was very happy to get in bed with the liberals. But now that we have a democratic regime, they need to have their feet held to the fire, and we need to be yelling and screaming and abusing them. So I actually think the rhetoric of like contain the right provides a nice alibi for liberal and neoliberal depredations of working people. So that's what I would say to your friend. I have a strong sense your friend would not listen to a word of that. So that's probably not useful, because I don't know, you know, how one gets good-hearted liberal people to understand their complicity with injustice in a way that doesn't shame them, I think is an important coalition building political question. And I don't really have answers, but I kind of, so I suppose I'm saying I'm disagreeing with your friend. And that's why. I also have lots of friends like that, so.
Unfortunately, I also have lots of family like that, but that's not the story.
Yeah, we all do. But the problem is, if you want to contain the right, you have to organize people to fight the right, right? You can't just somehow expect them to wither away. But that's you might as well organize to make people's lives better at the same time, right? I mean, it's again, for me, it's a very false notion of the process that we're all engaged in of trying to figure out ways to change the world. I mean, you know, it probably takes all of us, you know.
There's been a lot of work being produced by movements. So I wanted to I put that one in about transformative justice. This is a new book called The Red Deal, which is by this amazing kind of Indigenous youth-driven collective. And they have, it's more of like a manual strategy kind style of book. But I wanted to emphasize those because I think there is, our conversations can sometimes remain conceptual. And I think there's actually a lot of interesting, important strategy coming out of movements right now. So just wanted to share a couple of those. There's so much more out there. We are also, is this the end of the session? I believe 2:30. So I think it is my job as the moderator to thank you all so much for attending. Thank you to the panelists as well. I really enjoyed, just the chance to hear from all of you and think across your insights. If any of you have closing thought you'd like to share, please do, and then we'll end the session.
Yes, thank you, Pavi, and such a lovely conversation. Like I said, you know, we started off with so many questions about what is care, what is work, and we have more questions now. So, you know, that's good.
Liza just posted the next event for the pop-up. And I think we are done for today with this event. So thank you again, and hope to see you at the next pop-up meeting.
Thank you, everyone.
Carrie, Libby, thanks so much for joining.
Thank you. I love this conversation. This was really fun.
It was great.